So picture this, it's 1982, in a quiet suburban bathroom. Just an ordinary morning, an ordinary cold, and a totally ordinary painkiller. But what happened next? Well, in just a matter of hours, that simple act of taking a pill would unleash this wave of terror that didn't just grip a city, it gripped the entire nation. And believe it or not, it would change the way we all live forever.
I mean, listen to these absolutely harrowing words from Dennis Kellerman, the father of the very first victim. It's the morning of September 29th, 1982. And his 12-year-old daughter, Mary, she just has a sore throat, a runny nose. So he does what any parent would do. He gives her one extra-strength Tylenol. And just minutes later, she collapsed, and she died. At the hospital, the doctors, they had absolutely no answers. The Kellerman family, they had no way of knowing they were standing at the very beginning of a national nightmare.
See, Mary's tragic death, it wasn't some isolated one-off medical mystery. No, it was just the first domino to fall. And what followed was this terrifying chain of events that started unfolding all across the Chicago suburbs. A remedy that everyone trusted had somehow just inexplicably turned into a deadly poison. And the speed of all this was just terrifying. The connections, absolutely chilling. Just hours after Mary Kellerman died, a postal worker named Adam Janis collapsed. So his family, they're distraught, they rush over to his house, grieving, and now they've got headaches. His brother Stanley and his sister-in-law Teresa, they take Tylenol from the very same bottle. And moments later, they were dead too. Then over the next 2 days, 3 more people died just as suddenly. Think about that. 7 deaths in 72 hours. All of them looked totally random, and it was completely baffling, the first responders.
So where did the breakthrough come from? You might think some high-tech lab, right? Nope. It came from a conversation. Just 2 off-duty firefighters talking about the bizarre cluster of sudden deaths they'd both responded to. And they connected the dots. They realized the single common thread linking every single victim. It wasn't a virus, it wasn't a shared meal. It was that little red and white capsule, extra-strength Tylenol. And just like that, with that one realization, this whole thing switched from being a series of medical emergencies to a full-blown murder investigation. It didn't take long for investigators to figure out the murder weapon. The capsules had been laced with potassium cyanide. Now this stuff is a poison so potent it can kill you in minutes. It basically suffocates your body's cells from the inside out. Let's be really clear here. This was no accident. Someone, deliberately, had turned medicine into a weapon.
But then, the investigation revealed something even more terrifying. See, the tainted bottles, they came from different factories. One in Pennsylvania, one in Texas. And that meant the tampering didn't happen on the production line. Oh no. The killer had walked into multiple stores right there in the Chicago area, taken bottles off the shelves, opened them, injected the capsules with cyanide, and then just put them back for anyone to buy. The randomness was the point. This was, for all intents and purposes, an act of domestic terrorism.
Okay, so this brings us to the company at the center of all this, Johnson & Johnson. Their most trusted product, this household name, was now a symbol of pure fear. So the question is, what do you do? How do you respond when you're faced with a crisis that could literally destroy your entire company?
And believe me, the stakes could not have been higher. Let's put this into perspective. Tylenol wasn't just another product. It was an absolute titan. It had a 37% share of the pain reliever market. That means it was outselling its next 4 biggest competitors combined. This one product was responsible for nearly 20% of Johnson & Johnson's entire corporate profit. They had literally everything to lose.
So what do? They made a decision that was, frankly, radical. They didn't just recall the suspicious batches from Chicago. No, they pulled every single bottle of Tylenol off of every single shelf in America. That's 31 million bottles. Nobody had ever done anything like this before. It was a move aimed at one thing and one thing only, protecting the public no matter what it cost.
And that cost? It was absolutely staggering. We're talking over $100 million. And remember, this is 1982 money. The company made a choice, a really clear one. People over profits. They willingly took this massive financial hit just to make sure that not one more person would die.
And the immediate impact on the business was just devastating. Tylenol's market share didn't just drop, it fell off a cliff. Almost overnight, it plummeted from that dominant 37% all the way down to less than 8%. All the experts, all the pundits, they were declaring the brand completely dead. It just seemed impossible that they could ever recover the public's trust. But inside Johnson & Johnson, they were operating on this one core belief. They knew that in the long run, the story wouldn't be about the crime itself. It would be about how they handled it.
Their response was going to be their legacy. And even as they were managing all of that fallout, a massive nationwide hunt was underway for the person who did this.
So while Johnson & Johnson is dealing with this massive public health crisis, law enforcement is in a desperate race against time to find the killer. But here's the problem: there are no witnesses. There's no clear motive. Investigators had almost nothing to go on. I mean, who would do something this monstrous?
And then they got a break. A really chilling letter shows up at Johnson & Johnson headquarters. The person who wrote it claims to be responsible and demands $1 million to stop the killings. The tone of the letter was just taunting, arrogant, and it gave the FBI its first real lead.
Okay, so the letter was traced to a man named James Lewis. And this is where it gets complicated. On the one hand, the case against him seems pretty compelling. He admitted to writing the extortion letter, he had a violent criminal past, and get this, he even gave investigators these bizarrely detailed drawings of how the killer might have done it. But, on the other hand, the crucial pieces just weren't there. Police could never prove he was actually in Chicago when the poisonings happened, and they never found any direct physical evidence linking him to the cyanide itself.
So in the end, James Lewis was convicted, yeah, but only for the extortion. He served about 10 years in prison and was released. And to this day, the Tylenol murders remain officially unsolved. The person responsible for all that terror has never, ever been brought to justice.
So the criminal case is still a mystery, but the tragedy itself, well, it left behind an incredibly powerful and visible legacy. The deaths of those 7 people forced this fundamental ground-up change in how we think about the safety of pretty much every product we buy, every single day.
You see, this crisis gave birth to a whole new concept: tamper-evident packaging. The industry had this realization: you can't make something completely tamper-proofed, right? I mean, a real customer has to be able to open it. So the goals shifted. Instead of tamper-proof, they aimed for tamper-obvious. The idea was to make it so that if anyone messed with the package, you'd know it right away. And Tylenol, they led the charge. They introduced this brand new triple-sealed package. Okay, so first, the box itself was glued shut. Second, there was a plastic seal wrapped around the cap and the neck of the bottle. And third, a foil seal was glued right over the mouth of the bottle. Those 3 barriers, they quickly became the new industry standard.
Of course, the government followed suit. A year later, in 1983, Congress passed what everyone started calling the Tylenol bill. This law made product tampering a serious federal felony, and it sent a really clear message that consumer safety was now a national priority.
You can really think of it as a clear dividing line, before 1982 and after 1982. Before, we lived in a world of simple screw caps and boxes you could just pop open. After 82, we got those multi-layer seals, the invention of the solid, hard-to-tamper-with caplet instead of capsules, and federal laws to back the whole thing up. The world of consumer products literally changed overnight. So what about Tylenol? Well, that massive $100 million gamble, it paid off. Big time. By putting their customers first, being totally open with the media, and leading the way on safety innovations, they pulled off what most people thought was impossible. Within a single year, Tylenol had regained its entire 37% market share. Their response is still taught in business schools today. It's the absolute gold standard in crisis management. And really, that's the thing to remember. The impact of this story is literally all around us, every day. Think about it. The foil seal on your yogurt, the plastic wrap on a jar of peanut butter, that little pop you hear when you open a bottle of juice. Every single one of those safety features we take for granted is a direct legacy of the 7 people who died in Chicago back in 1982.
And all this leaves us with a really complex and, honestly, a haunting question. The killer was never caught. Their motive is still a total mystery. But in a strange, ironic twist of history, you have to ask, did this horrific, random act of evil accidentally make the world safer for all of us? It's a tough paradox, and it's one that was born from one of the most terrifying crimes in American history.